Welcome to HealthAlliance and You, a health and wellness series brought to you by HealthAlliance in the Hudson Valley. I'm Josh Ratner. Lyme disease is the most commonly known illness associated with ticks, and rightfully so, since according to the CDC, an estimated 300,000 people in the U.S. are diagnosed with it each year. However, there are several other diseases that ticks can spread. Here to talk with us today about tick-borne diseases is Dr. Marc Tack, Director of Infectious Disease at HealthAlliance.
Lyme disease is a bacterial infection caused by a bacteria called Borrelia burgdorferi. This is a bacteria that is transmitted through the bite of a deer tick, usually the nymph deer tick. In order to get infected by Lyme disease, you have to be bitten by one of these deer ticks, and it has to be on you at least 24 hours, and it has to be itself infected with the bacterial infection. The tick feeds off of deer and off of mice, and it usually acquires the infection from an infected deer, carries the infection, and then at the end of its feeding cycle on a human, which is an incidental host, it infects you. It's endemic in the community. Deer are infected, they're carriers, and the bacteria moves from place to place through the bite of ticks. The earliest symptoms of Lyme disease are a fever, a large circular rash. People often describe it as a bullseye rash, but it's not always a bullseye. It can just be a large round rash. It tends to get larger day by day, and 5 centimeters is actually the cutoff point. It has to be a minimum of 5 centimeters. And it's usually associated with symptoms such as muscle aches, joint pains, headaches, and fatigue at the time of this illness usually occurs about 10 to 14 days after the tick bite. Most commonly, the rash is seen where the bite occurs. There are some people who get what we call disseminated Lyme disease, and they can get multiple rashes. We've seen over 100 rashes on patients at times. It's unusual, but it does happen. If someone is concerned that they have early Lyme disease, and particularly in the spring or summer, a fever, a rash, or the symptoms I just mentioned, they should immediately seek medical attention. Their physician should be tuned into the possibility of Lyme disease, and often just by history and examination, the diagnosis can be made. And then certainly there are laboratory tests that can be ordered to help confirm the diagnosis if it's unclear. When a patient comes in with a bullseye rash, blood work isn't necessary. Just the presentation alone should make the diagnosis very evident. The risk factors are the types of things that put humans in contact with ticks. So going out, hiking on trails into the woods, mowing your lawn, doing outdoor activities where you can potentially get exposed to a tick are risk factors. Particularly in the Hudson Valley, we live in an epidemic region, so one needs to be aware that from late spring through the summer and into the early fall, you're at risk for deer tick bites. If you get Lyme disease and you're diagnosed early, as in the time of the rash or fever, and you get treated, that's a very easily curable disease. If you don't get diagnosed and treated early, your immune system will kick in and often fight the infection off. In the future, though, you may get some of the later complications of Lyme disease. That can involve arthritis. Now, specifically, that's not all of your joints hurting. It's usually a large joint, such as the knee, filling up and getting swollen with fluid. You might get heart involvement, and that specifically is that Lyme disease can infect the conduction, the electrical system in the heart, and the way your heart conducts electricity. It doesn't cause heart failure or heart attacks. And Lyme can affect the central nervous system, and it can cause an infection. It's called meningitis, but it's not the same as acute bacterial meningitis. It's a subtle disease where you might have problems searching for words, forgetting things, dropping things, and being a little more confused than you were previously. All of these are treatable. There are things you can do to help avoid Lyme disease. When it's Lyme season, you want to wear light colored clothing so that you can easily see ticks. You want to, when you can, tuck your pants into your socks so that there's no opening for the tick to get in. You want to avoid low bush and foliage where the ticks may be able to get onto your body at a higher level. When you get out of the Lyme area, the woods or the grass, you want to check yourself to see if there are any ticks on you because certainly if you pull them off within the first 24 hours, you won't get Lyme disease. Obviously, avoiding grass and outdoors is a sure way to avoid getting Lyme disease, but we live in the Hudson Valley because most of us love to be outdoors and in the woods, the grass, the fields, and so on. Besides Lyme disease, the two most other common diseases in the Hudson Valley from tick-borne illnesses are one called Ehrlichia, or a new name, Anaplasma. This is a disease that shows up with headaches, fever, body aches, but not the typical rash. Unlike Lyme disease, though, Ehrlichia is a self-limiting disease, so you either get over it on your own or you get to a doctor and get treated, but either way, within a few weeks, it's gone. The other disease that's becoming more prevalent in the Hudson Valley is a disease called babesiosis. Babesiosis is a parasitic infection transmitted by tick bite that can infect your red blood cells, similar to the way malaria does in other parts of the world. It can cause fevers, severe headaches, and in people who don't have a spleen or who are immune compromised, a very serious illness which can cause anemia and very rarely death. Again, a disease that can be diagnosed and treated and cured, though, with routine current therapy.
We hope you, the viewers, found this edition helpful in answering your questions about tick-borne diseases. Remember, if bitten by a tick, remove it immediately and make sure all of the tick's mouth is removed. For more health information or to view this episode again, visit hahv.org. Join us next time for another segment of Health Alliance and You for details on how to stay healthy.